Hi, my name is Jonathan Finoff, and I'm going to be demonstrating a live ultrasound examination of the lateral ankle. I don't have any disclosures, but I do have a disclaimer. This presentation is not meant to be a comprehensive review of this topic. Our objective is to cover the core competencies as outlined in the AMSSM recommended sports ultrasound curriculum for sports medicine fellowships. So now we're going to do the lateral ankle examination. And I like to put the patient so that they're side-lying, bolster on the medial aspect of their ankle, so it puts their ankle into a little bit of inversion, and that way it puts their ligamentous structures in the lateral aspect of their ankle on tension. So the first thing I'm going to do is look at the anterior talofibular ligament. And so here you can see posterior is going to be on the left of the screen, anterior is on the right of the screen, and you can see a fibular structure between the fibula and the talus. So this is the anterior talofibular ligament, the ATFL. You can do an anterior drawer test and assess the stability of this ligament. If I rotate the transducer, in this particular case, in a counterclockwise position, so I bring it up, then I'm going to be looking for the AITFL, or anterior inferior tibiofibular ligament. So I'm going to rotate it. You can see the talus right here. The talus drops off, and the tibia comes in. And here you can see the anterior inferior tibiofibular ligament coming across right in this area here. And again, you can do a tibiofibular compression test where I squeeze the tibia and fibula together, see if it separates. You can do an external rotation stress test and so on, but you can certainly see that these ligamentous fibers are intact. I'm going to show you the calcaneofibular ligament when we're looking at the peroneal tendons. So we'll start off with the peroneal tendons coming up a little bit more cephalad. Remember, the peroneus longus sits superficial to the peroneus brevis. So as we come down distal, this is the peroneus longus tendon. Here's the peroneus brevis tendon. Here's the peroneus brevis muscle. Back here is the peroneus longus muscle. This is the fibula. So as we come down distally, you can see how these tendons are becoming larger and the muscles are becoming smaller. And we're going to come down here, and we're going to get behind, right here, the lateral malleolus. And in this area, the superior peroneal retinaculum is located. And right here you can see the origin of the superior peroneal retinaculum off the posterior aspect of the fibula. And here you can see the fibrous bundle of tissue of that superior peroneal retinaculum. And here are the tendons. So I'm going to have my model dorsiflex their foot, and then plantar flex their foot. And then they can certainly circumduct it. So go ahead and circumduct your foot or your ankle. And I'm looking for intrasheath peroneal subluxation or a dislocation of the peroneal tendons over the top of that lateral malleolus, which it did not happen. And here you can see, again, that superior peroneal retinaculum right up in that area. So as I come down distally, we're going to come down inferior and caudal to that lateral malleolus. And I'm going to put a little bit more gel here. And as we go down underneath that inferior margin of the lateral malleolus, and I'm going to increase the gain here a little bit. I'm going to change the focal zone a little bit deeper. So deep to the peroneal tendons is going to be the calcaneofibular ligament, the CFL. So right down in this area here. So I'm going to have the model dorsiflex their ankle. You can see the CFL becoming taut right here and lifting the peroneal tendons up off of the floor, which would be in this case the calcaneus and the talus over in this area. So go ahead and plantar flex. You can see that the CFL ligament becomes lax. So dorsiflex again, it becomes more taut, and then plantar flex, it becomes more lax. And here are those peroneal tendons. So as I glide distally, we can follow those peroneal tendons down here. Here's the peroneal tubercle. The peroneal tubercle will separate the peroneus brevis, which is going to be a little bit more on the dorsum of the foot, from the peroneus longus. Now I'm just going to follow the peroneus longus down here a little bit further, and it will wrap down around the edge of the cuboid. So now I'm going to come back up to that perineal tubercle, and I'm going to follow the peroneus brevis all the way down here to the base of the 5th metatarsal. You can certainly look at that in long axis here as well. So here's the peroneus brevis tendon. Here it is attaching to the base of the 5th metatarsal. The last structure on the lateral ankle examination is going to be the sural nerve. So here are the perineal tendons again. I'm going to come just posterior to them. And so this is the lesser saphenous vein, and sitting right in this area is going to be the sural nerve. So you can see the sural nerve right here as I glide down distally. I'm going to change the location of the focal zone. So here's the sural nerve right here. See that honeycomb structure right here is probably one of the best pictures of it. And that completes the lateral ankle examination.